Medical terminology. So this presentation will help you with hybrid 1B. Just a short little quiz to test your understanding. So basic elements of medical words, and then we'll learn the rules. Once you learn the rules, there's only like a few points to know. Then you can make any medical term out there. All right, so we'll talk about word roots, combining form. It's usually an O, help us in pronunciation. Suffix, do they go at the beginning or the end? And prefix at the beginning, right? And just think of the alphabet. P comes before S. Makes it easy. Yeah, just the basic rules. And then we'll go over some word roots. Don't try to memorize them all. I'm not going to go through all of them. I'm just going to expose you to some of them.
How are you writing on the PowerPoint?
You have to go to slideshow. So you have to go to presentation mode. And then if you right click or go, you had me before. I taught you already.
No.
No, just kidding. All right, so simple rules. We'll talk about those. That's it. Only a few, and if you get them down, you'll be fine. It looks daunting because there's hundreds and hundreds of different parts to put together, but once you learn the rules, you should be okay. So don't be scared. Just have your flashcards. Do you guys bring them?
What?
Good. Every single word root, make a flashcard because that's going to be your learning tool, right? Because you're going to go through them, shuffle them up, make a pile of the ones you know and a pile of the ones you don't know, and just work on the ones you don't know. So word root, so that's the basic meaning. It's usually the easiest meaning as well for whatever the medical term is going to be. So we got the basic meaning, and then we're going to add an O if we need to at the end to make it easier to pronunciate and link together. So we got the main basic meaning, and then we're going to modify it. Right? We can put stuff in front to modify it, or we can put stuff at the end to modify the basic meaning. And that's pretty much all medical terminology is. Don't try to memorize all the terms. Break them down to their parts and learn their meaning. Suffix at the end to modify, and then prefix at the beginning to modify. Latin, Greek. Do people still speak Latin? No, Latin's a dead language. Do people still speak Greek? Yeah, but here they're referring to ancient Greek, which is a little bit different. So pretty much dead languages, Latin and ancient Greek. What is a Latino? Don't worry. Don't worry about political correctness. What's a Latino? So what does that term come from? What does that mean? Just Spanish people? South American? What's Hispanic? No. So Latino is supposed to be if you have a Latin-based language. So Spanish is Latin-based, Portuguese is Latin-based, French is Latin-based. That's the real meaning, but of course we use it for whatever we wanted. Greek, ancient Greek, people don't really speak anymore, but of course there's still Greek in Greece. So we'll modify that word root with a suffix and or prefix, but every word must have a suffix. So that's one of the rules. Every medical term must end in a suffix. If it doesn't, you're not a word medical term. So you only need two things, a word root, suffix, that's it. So here are some examples. Cardi is, of course, the heart. Cardiologist studies the heart. Gaster, that's stomach. Yeah. You might get gas there, but it's really not in your stomach at that point. Hepat, what's hepatitis? What does that affect? Yep, the liver. So hepat is liver. Nephro, that's probably something different for you guys. So nephron is short for nephron, which is a part in your kidney. Yeah. Another one for kidney is like a ren for renal. So you will get multiple word roots for the same meaning. Osti. Any guess? Bones, yeah. Are your osticles or the bones in your ear? Ossification is turning into bone. So you don't have to write these down. You have the PowerPoints. Just follow along. And then I'll record this, post it as well. All right, combining form. 99% of the time in this class, for us, it's going to be an O. So very rarely will we use the I. But this vowel is added to the end of the word root to facilitate pronunciation. For example, cardi becomes cardio, gaster, gastro, hepat, hepato, nepher, nephro, and then osti, osteo. So that's combining forms. Really easy. 99% of the time it is which letter? O. And then the second most common is I. So if in doubt, just use the O. Suffix, they're going to modify. So they might tell you a particular procedure, condition, disorder, or disease. What is senioritis? Of seniors? So we've been using it wrong all this time, right? So you have to say senior, bad condition, abnormal condition, osis. That's abnormal condition. Itis is inflammation. So here are some additional suffix. Synthesis. Anybody been in maternity, pregnant? If there's complications, this is one of the tests they might use. They might puncture the womb, get some fluid. That's amniocentesis. Ectomy. So there's 4 or 5 different tomies. If you see the one with the E, we're going to exit it out of the body. So that means we're going to cut it. E is for excision. We're going to cut it and remove it out of the body. Itis, we already went over. That's inflammation. So senioritis is incorrect. It's freshman 15. You guys know what freshman 15 is? No. So when you go off to college, you gain 15 pounds as a freshman. Stress, eating badly, hanging out, I don't know. Megali, what's mega? Do you think that's big or small? Yeah, mega millions. Do you want mega millions or micro millions?
Either one.
A million's a million. Enlargement. So growing, getting bigger, megali. And then seniorosis is the correct term, which is an abnormal condition when seniors slack off that last year. They only take PE, art, music, drama, and then doesn't prepare them for college. Seniorosis. All right, prefix at the beginning. So similar to suffixes, they're going to give some modifiers. So additional, descriptives for the word root. Do medical terms need prefixes? No. All you need is a word root, combining form, maybe, and a suffix. Prefixes are optional. You don't have to have one. So word root, suffix, must have. A. A is without. Another one for without is an. Right? Hyper, high or low? Yeah, excessive. Intra. So we have intra, we have extra, outside, and if I'm in between, I am inter. So just one little tiny letter changes what it means. Intra, inside. Inter, between. Extra, outside. Macro, big or small? Yeah, big. Micro would be the opposite. So a lot of these, just learn them. in opposites. Learn them in tandem, makes it easier. And many of these prefixes, suffix, and word roots you already use, but now we're just giving definite definitions to them, definite terms. Epi is above. What is the epicenter? You're in earthquake country. So where the actual earth shook, the epicenter is the location right above it. So if they said Northridge, the earthquake happened below Northridge. Loma Prieta, right? San Francisco, that's the epicenter, right above where the actual earthquake occurred. All right, let's get into the rules. Now that you know the parts, let's put them together. Rule number 1, look at the suffix. Look at the first letter of the suffix. If it is a vowel, you do not use the O. So here in itis, that's a vowel. I is a vowel. Osis, that's a vowel. So you just do neuritis. You don't need the O. Sclerosis, you're not going to do a double O. Sclerosis. So if the suffix starts with a vowel, you do not use the O. So what if it starts with a consonant? Then you use the O, right? So that's one of the rules that will come up a lot, because do I use the O? Do I not use the O? Now you know. Vowels, no O. Consonant, yes, you have to use the O. So we have neuroplasty, surgical repair of a nerve. Colonoscope, instrument for viewing the colon. All right, in between multiple word roots, just add the O. Right? So gaster is stomach, enter is intestines, so your stomach and intestines. Osteo is bone, ather is your joints, so this is bone and joints. So inflammation of the stomach and intestines, inflammation of the bones and the joints. Do you need a vowel for prefixes? Is it hyperactive or hyperoactive? Yeah. So you do not use a combining vowel. So there's no O there. There's no hyperoactive. It's just hyperactive, right? Defining. Anytime I ask you to define, make sure you define in this order. Define the suffix first, prefix, then word root. So you have to go with the ending first. Inflammation within, en is within, endo is within the heart. Information within the heart. Here we have pertaining to. Trans is across. Neuro is nerve. Coastal is ribs. So you have to do suffix, prefix, and then go back. So anytime you define, make sure you do it in that order. All right, test your memory. Synthesis. You guys remember? Puncture. What about ectomy? E is for exiting, right? Yeah, we're gonna cut it out of your body. Excision. Itis. Senioritis? No, not senior inflammation. How about Magali? Yeah, enlarged. Osis? Senior osis now. There you go. You can just say condition. We know if it's a condition, it's gonna be abnormal. Right? Save you guys some time. What's A? Without. Another one is an. Anaerobic. Hyper is excessive. Intra, within. Yeah. Intracellular fluid, that's fluid inside. Interstitial fluid, that's fluid in between your cells. How about intra? Oh, we did that. How about macro? Large. Epi? Above. The epicenter is above the actual earthquake. Well, not too bad. All right, so I'm not going to go through all of these with you guys, but just a few of them to get you guys familiar. So we did heart already. Cardi is heart. Gaster is stomach. Hepat is liver. Nepher, do you guys remember? kidney. Oste was, who's your dermatologist? What do they look at? Yeah, so now we're putting definite terms or meanings to these word roots. Arthritis, what does that pertain to? Arthur, joints. Thorac, yeah, your thoracic area. Col or coli is short for your colon, your large intestines. Enter, that's your intestines. Your gastrointestinal system. Chondro is cartilage. So when we do a body organization, we'll talk about the cartilage area in the body. Rhino, take a guess. Rhino, you know, rhinoplasty, a rhinoceros. Spleen, you guys know what your spleen is? How many E's in spleen? 2. How many E's in the word root? 1. So make sure you don't put 2 E's for the medical term. Hyster, what's a hysterectomy? What got removed? Uterus. So if you get a hysterectomy, you get menopause twice. Congratulations, you won. Neuro's easy. Yeah, brain, nerves, neurons. Oto. Otic. Yep. Oto, toxic to the ears. Hydro's easy. Hydro with a Y. What's hydro with a Y? Water. Hydro with an I? That's sweat. Right? Just one little tiny letter changes the definition. With a Y, it's water. With an I, hydra, that's going to be sweat. Just a little tiny letter changes the meaning. Toxic poison, mass. What's a mastectomy? Breast, yeah. Angelina Jolie style. Cyst is a sac or a bladder. So cyst could be your urinary bladder. It could be your gallbladder. So generic for bladder. What's phlebotomy? Vein. So it's vein only, not veins or arteries, just veins. Pancreato, that's just short for pancreas. Sclera, couple of them. But sclerosis, you guys heard of liver sclerosis? Hardening of the liver. Cephal is your head. What is encephal? What's inside your head? Your brain, yeah. So they added on that prefix. Have you heard of your meninges? You might get meningitis. That's an inflammation of your brain, your central nervous system. Myo, muscles. What's a megalithic structure? What's a monolithic structure? You heard those before? So anything made out of stone. So Stonehenge, the pyramids, Sphinx. If it's one, monolithic, because it's just one stone, like the obelisk, those big old towers. Bronchi, that's in your lungs for your bronchus. Carni is short for cancer. Carcinoma would be cancer. Chol, short for cholesterol. Thing you need to digest cholesterol is bile. So they gave it the gallbladder. Psych has to do with the mind. Another one for mind is phren. You guys heard of that? Schizophrenia, you guys probably heard of. So schizo means to split. Phren is the mind, so splitting of the mind. Therm is heat. Pelvis. Lips, not these, is short for lipids, which is fat. Right? Lip is fat. Aden's a gland. Multi is many. Hemi, what's a hemisphere? Do you live in the northern or southern hemisphere? So that would be half. Hemi is half. Half the globe. Dysfunctional, think of painful, abnormal, like in a family, dysfunctional family. Heme is blood. Hemato is also blood. Claustrophobic, confined faces. Coster. Men. No, men don't do men. Men is for your menses. Dia? What's diarrhea? through, goes right through you. What's a diagram? You can see right through it. So diarrhea is just flowing right through you. Angie is a blood vessel. Generic. It could be a vein or an artery for Angie. Procto. Would you shake a hands with the proctologist? Anus, the butt doctor. Belfour are your eyelids. Arteries, artery, just artery only, not veins. Thyroid, muscles, saliva. Med, usually the middle or medical. Audit, audition, you have to perform. They have to be able to hear you, right? What's an auditorium? Somewhere you go to hear a message. Cutane, where is subcutaneous? Under the skin. Acus, when you play a guitar without electricity, that is a acoustic guitar. Acus. Pneumo, lung. Lung, not too bad. Pet or pod? Pet is feet and or child or youngster. Pod is feet. Urine, easy. Birth. Elbow. So your cubital region is your elbow. Olecranon, cubital, anti-cubital, the inside of your elbow. Derm we had already. Derm or dermato, cutane. Pubis. Nose is nasal. Opt. What's opt? Yeah. Oh, I have acus again. We can skip that one. Glyco. Gluco, glyco has to do with sugar. Sugar or blood sugar. We'll just go through these real quick. Head. Ceph. So encephala. Ines. Usually you guys are familiar with anesthesia or anesthesia. So that's without. In this case, it's sensation. Your sternum or your oral cavity. Ocu for eyes. Ren, kidneys. Cyan is what color? Blue. And then we have urethra, which is red. Zan, which is yellow, right? Leukocytes are what color? White. And then your pigment cells are melanocytes, so they produce the dark pigment, black. Holy gray, mixture. Not too bad, just a taste of some of the word roots. So let's go on and complete hybrid 1B.